Now, Bellafill is FDA approved for soft tissue filling of the nasolabial folds, the smile lines, and acne scars using a fine needle where it's been shown to last through 5 years. Now, as often is the case, doctors then use the FDA approved product in ways that are different than the initial FDA study, and then it's called off label use. This video will help you get a better understanding of how this product can be used to safely restore the facial volume while preventing or minimizing bruising, pain, swelling, and obtain the best results possible with this facial filler. Now, the product contains cow collagen. So patients should have a skin test on their forearm to rule out the very rare patient with allergy to cow collagen, as otherwise you might see months of itchy red swelling where you inject it on the face. You happen to be that rare allergic patient, it's usually an obvious large red itchy swelling of the injection site on your forearm for less than a week. Now the procedure starts with determining how many syringes will be needed for optimal correction, and then you decide how many syringes they want to inject at any given time. Since the fees for injection are often around $800 per syringe, most of my patients want to try just 1 to 2 syringes at a time, as that is what their budget allows. Now, the lower lids can typically use 1 syringe per side. Temples, if they're a little hollow, can use 1 syringe per side. Cheeks, if they're flattened or drooping from aging, can typically use 2 syringes on the left, which tend to age a little more, and then 1 on the right. The nasolabial folds, those smile lines everyone hates, can typically use 1 syringe per fold. The jawline can often use 1 syringe. And some have hollows even below the cheeks that can use 1 syringe per side. Thus, patients in their 40s usually need 1 box of 5 syringes, 50s need 2 boxes, and 60s need 3 boxes. Now remember that each box only contains 4 cc's, or just a little more than 3/4 of a teaspoon of product. So when you look at a patient, you can first say it looks like you've lost about 1 or 2 teaspoons, or maybe a tablespoon of volume. Then you explain how this corresponds to 1, 2, or 3 boxes of Bellafill. Then you let them know that it's packaged in small syringes that are enough for just 1 small area at a time. But since my patients are on a budget, they do choose to focus on these 1 or 2 small areas at a time. Thus, you need to decide which area to start on, as typically it takes 1 to 2 syringes just to correct any given area on the face. Most patients want their nasolabial folds, their smile lines, filled in. We always mention that if we were to lift the cheeks and temples 3-dimensionally with Bellafill, then the fold gets flatter and you don't have to put that much in the fold itself, because if you put too much in the fold, it starts looking more like a chipmunk. The problem is that lifting often requires 3 to 4 syringes of filler, so most patients choose to fill the fold in directly first. The fold typically requires 1 syringe per side to see nice improvement. Now, many patients start with half a syringe per side and return after 3 months for the other half syringe per side. The cow collagen often disappears at the same rate as the human collagen replaces it, so the correction many times just continues to improve. Unfortunately, in many patients, the cow collagen practically disappears in 3 to 6 weeks, and it takes 2 to 3 months to get the human collagen to grow and fill it back in, so patients often believe the initial correction quickly fades. Fortunately, it generally returns at 3 months. Another small area that patients often request is the tear troughs, or those hollows by the nose under the eyes, or even just the lower lid hollows. Now, it's best never to put in more than 0.3 cc's per teardrop, which means basically 1/3 of a syringe, at any given time, even when more is needed. The skin is thin, and the product tends to be heavy for the first 3 months when it's stimulating growth of new collagen. It's essentially like a mild inflammatory reaction that attracts just a little extra fluid for 3 months. So if you're correcting the entire lower lid hollows and upper cheeks, then you can use up to 1 syringe per side. But I prefer to correct it by less than 50% and using half a syringe per side, and put the other syringe in 3 months or later. This way you never get a lot of fluid collection in the lower lids. I explain it with an analogy. If you know it's going to take 2 to 3 coats of paint to cover the wall, you never put on all 3 coats at once. You let it dry between coats so it comes out smooth and beautiful in the end. Since the product attracts little water for 3 months, I say it takes 3 months to dry. Therefore, it's of utmost importance that you do the injections in a way that they don't hurt. don't bruise, and don't swell for more than a day, or most patients won't return for their second and third coats. That's why I use lidocaine for numbing and epinephrine in blunt cannulas to prevent bruising. And in the lower lids, you also cannot rub against the undersurface of the dermis, or you get immediate swelling and delayed bruising. Thus, first I mark the areas I have agreed to inject with the patient, and usually I plan to put in a little more on the left, as most patients have aged more on the left from driving a car, and the extra decades of daily sun damage have accumulated more on the left face. I use a Sharpie as it's easy to remove with peroxide. Next, the injection sites are marked as circles, as I don't want to put a needle through the ink and tattoo the patient. Then I prep with Hibiclens to prevent biofilms. These are bacterial injections, basically. And then I cool the skin with the Zimmer cooler, which decreases bleeding and discomfort. Then I inject in the superficial skin, an intradermal bleb, a small amount of 1% lidocaine with epinephrine, which is buffered with bicarb to take away the sting, in the finest needle, wherever I plan on inserting the blunt cannula. Then I allow time for the skin to turn white. Then I like to make an opening the size that will readily allow the blunt cannula to enter from all angles without ever bending that cannula or having it, you don't want to have to stick the needle in repeatedly either. That's more traumatic. Since the openings always heal in a day, I prefer to use an 18 gauge needle. Then immediately put pressure on the site for 3 to 5 minutes so you don't get bruising. Then I chill the area again and then inject subcutaneously just beneath the skin half to 1 cc of buffered 0.5% or 1% lidocaine with epinephrine with the 2-inch blunt 25 gauge blunt cannula wherever I plan to inject the Bellafill. These cannulas can be found from various vendors. Dermasculpt is one of them. You need to be careful to slip in gently just beneath the skin without rubbing against the skin, because this causes swelling and it can even cause delayed bruising. So usually enter 60 to 90 degrees to the skin, and then you quickly turn to whatever angle you need before you go too deep. Then pressure is applied again and wait another 5 to 10 minutes for the skin to turn white, so you know that it's unlikely to bruise when you inject, as white means the skin no longer has blood in that area. The Bellafill you plan to inject will have been kept in the refrigerator. But unfortunately, when it's refrigerated, it's so thick when it's cold that it's difficult to inject even with a 25 gauge cannula. It also may separate the crystals from the collagen if you try to inject it while it's cold. Thus, you need to take it out for 15 minutes or more before the procedure, or heat it up in your hands for several minutes. Never obviously put it in the microwave. So first, you put the cannula on tight with your fingers. Then I like to use pliers to make it even more snug, since if it pops off and you squirt that product on the patient's face, you've lost several $100s. So then you inject the amount you predetermine as enough, preferably for a 50% correction or less, and inject from multiple angles, realizing you're going to be doing it again several months from now. So all the time you try not to be rubbing against the skin with the cannula, and you want to stay above the muscle if it's in the lower eyelid area. When you're done, you put pressure for 3 minutes and then massage with recovery gel. Have the patient gently massage the area twice per day for 20 seconds with the recovery gel. The recovery gel has arnica, montana to prevent bruising, and vitamin K and growth factors in it. Now, if it's desired, you can have them start on the Regenica creams and serums and Refisa, which is retin A, to enhance collagen production from the Bellafill, especially if they're postmenopausal. They benefit the most from these growth factors, as their natural ones are depleted when they're postmenopausal. Then have them return in 3 months or later whenever they can afford the next coat. The results are great when done properly. Not only does it restore the volume, but it stimulates growth factors release that rejuvenates the overlying skin. Before Bellafill became FDA approved, I was performing facial fat transfers on everyone who wanted long-term results. The biggest difference was the upfront cost, the equivalent of 2 boxes or 10 syringes of Bellafill, and the need to inject 4 tablespoons of fat in order to get 1 tablespoon of fat to live after 3 months. Thus, by definition, for the first 3 weeks, everyone was overcorrected and looked too young, sometimes 30 years younger. That faded and they would only look 8 years younger in the end, but it was disturbing for the first several weeks. Now with Bellafill, they can have their facial volume restoration 1 syringe at a time. This keeps the upfront cost down to a manageable level for my patients. They never have to look overcorrected or too young.